Hi everyone, I'm Hillary Granite from Core Physical Therapy. Today we're going to talk about three-dimensional breathing. Breathing is so important for everyday life, but also as far as movement, efficiency, and injury prevention, and even rehab. So three-dimensional breathing has to use your entire rib cage and your diaphragm. So what happens during the day as we're sitting at computers and posture, our spines get really, by slouching and slumping all day long, our spines become really rigid, our thoracic spine and our rib cage becomes really rigid. So to do three-dimensional breathing, first just lie on a floor or mat with your knees bent, and what you're gonna do is you can even put your hand right onto your stomach and just see where you naturally breathe, and one hand can be on your chest. And just kind of feel where you're breathing as you're inhaling and exhaling. And then most people breathe up in their chest, and some people breathe way in their belly. Breathing in the belly is much better than the chest because you don't want to be using all these accessory muscles or scalenes, and which will cause some neck pain and tightness there. So what we're going to focus on today is, as I said, three-dimensional breathing, where I want you to be breathing more laterally into your rib cage and even posteriorly. So if you look at babies or dogs or cats or any animal, when they breathe, their entire rib cage is expanding. It's almost like a bucket handle, and you want to be able to use that entire rib cage, and that's the best way to increase mobility of your thoracic spine, which, as I said, tends to get really rigid with all the sitting that we do. So she's going to put her hands right in her rib cage and her palms more laterally and posteriorly. And what you want to do is really focus your breath going into the palms of your hands, so you're like wings of a sail. This is going to open as you're breathing in, and then exhale. And by breathing this way, as I said, you're going to get all of your diaphragm using it, and try to do less chest. You don't want to see your rib cage flaring up. You really want to see it coming out to the sides. It usually takes a little bit of practice to get this, so go ahead and lie down and practice and just do a couple inhales and exhales, really trying to feel that whole rib cage expand. All right, go ahead and practice that. Have a great day.